When somebody is on a sports field and they get hit in the head, what do you look for then? You see sometimes players walking off, they've got a dazed look. What do you look for when you see somebody's been hit on the field?
Absolutely. It's one of those things that you really have to know the player and kind of their mannerisms and personality, because they're not always the first person to come tell you that they're having a problem. So we have a lot of excellent athletic trainers, myself and some of our other physicians, who monitor them, looking for personality changes. Are they involved? Are they engaged in the game? Are they pulling off to the side, sitting on the bench, kind of withdrawn? Clearly, if they're having headaches or nausea or vomiting, those are some symptoms that we can recognize or see. But they're all very little subtle things or cues that you have to pick up on and ask the player, are you doing okay? Did you have any problems from that hit or play that we just saw?
Will players deny, football players and athletes are tough and they want to be tough and they don't want to say, well, I don't remember what happened on it. Can you get a good evaluation by talking with somebody like that?
Yeah, I believe we can. Often players, some players will deny symptoms in fear that they may be removed from a game or pulled from a game. But just being able to know that player, talk to them, and basically educate them on the importance of this issue and how important it is to be honest, and that pulling back now and preventing recurrent injuries is going to save them time off the field later on if they continue to have head injuries.
When you suspect brain trauma in an athlete during an event where you want to be sure that they don't get back to you, let's talk about the things you look for. Mm-hmm. Why do you put how many fingers do I have, and why do you look at their eyes? What's going on? What are you looking for? Well,
the first thing you want to do is make sure that there's no significant injuries, i.e. there's no neck injuries or anything that would require urgent care. Certainly we do a focal neurologic exam, make sure their pupils are working correctly, their vision's okay, everything, all the nerves are working correctly to make sure there's not an intracranial hemorrhage or something of that nature. That's pretty rare, but certainly something you have to rule out. Then we actually, before our athletes even take the field, every year when they come in, we do some neurocognitive evaluations where we...
Neurocognitive, now that means how they're thinking?
Correct. How well they're processing information, what kind of reaction time, speeds they have, and we gather all this data by doing paper and pencil type tests, also computerized test. The one that we use is called IMPACT, so that we have some baseline data so we know how you function prior to any injury. Once an injury occurs, then we actually bring them to the sideline and we'll repeat some of those tests and compare it to their baseline to see if they're off.
So you get baseline before the season starts on the athletes.
That's correct.
Tell me about when you tell the athlete he can go back, or when do you make that terrible decision of saying no more athletics, no more head trauma for you? That must be devastating to tell somebody you can never play sports again if that's their game.
And it's a very difficult decision, and the time to clear someone to return to sports is difficult because, again, there's no blood test or an MRI or CT that can diagnose someone as saying they have a concussion or the concussion's cleared up, at least not to date. So it's, again, a lot of subjective and objective data points that we put together to make an educated guess or a best case scenario. We always bring the athlete in, we discuss the risks, what they should look for, and risk moving forward, so that they're educated in making that decision with us. Once we do that, then we return them to play and we monitor them very closely. But it's a gradual, progressive process.